1. Which of the following best describes the primary role of an expanded function dental assistant (EFDA) in clinical education? Supervising the dentist's overall practice operations. B. Assisting with procedures and performing delegated restorative functions. C. Managing financial records for patient billing. D. Developing community outreach programs. 2. When mentoring a new EFDA student, which approach best supports adult learning principles? Providing lengthy lectures with limited interaction. B. Encouraging self-directed learning and reflection. C. Requiring memorization of all procedures without context. D. Using only visual demonstrations. 3. During a preclinical skills evaluation, what is the most effective way to assess student competency? A. Written test on terminology. B. Observation using a standardized rubric. C. Self-assessment only. D. Group discussion of techniques. 4. Which curriculum development element ensures alignment with regulatory requirements? A. Course design based on dental assistant preferences. B. Inclusion of objectives tied to state EFDA certification standards. C. Randomized sequencing of topics. Optional evaluation criteria. 5. In clinical communication, what is the most effective strategy for giving feedback to a learner? A. Use a public setting to increase accountability. B. Provide immediate, specific, and supportive feedback. C. Delay feedback until the end of the semester. D. Focus only on negative performance aspects. 6. When training EFDAs, which regulatory body provides guidance for infection control standards? A. B. C. D. 7. Which evaluation method best demonstrates psychomotor skill proficiency? A. Multiple choice examination. B. Oral presentation. C. Clinical performance checklist. D. Peer review essay. 8. A mentor EFDA encourages reflective journaling after each procedure. This method supports what type of learning? A. Cognitive overload. B. Experiential learning. C. Rote memorization. D. Passive observation. 9. In developing a new FDA program, which steps should occur first in curriculum planning? A. Select teaching materials. B. Define measurable learning outcomes. C. Assign instructors. Design grading policies. 10. When a student consistently performs a restoration incorrectly, a mentor should first do what? A. Remove the student from clinical duties. B. Provide corrective coaching with demonstration and guided practice. C. Document the failure and proceed to reevaluation. D. Allow peers to critique performance. 11. Which ethical principle guides FDAs in patient confidentiality? A. Non-maleficence. C. Veracity. 12. In teaching clinical skills, simulation labs are primarily used to provide what? A. Replace real patient experience entirely. B. Provide risk-free environments for practice and feedback. C. Eliminate the need for instructor supervision. D. Assess financial management skills. 13. When designing evaluation rubrics for FDA students, what is the most important quality? Subjectivity. B. Reliability and validity. C. Simplicity without criteria. D. Instructor preference. 14. A key component of adult learning is that learners prefer what approach? A. Abstract theory over real-life relevance. B. Motivation by grades alone. C. Bringing prior experience that influences learning. D. Dependency on instructors. 15. Which action demonstrates effective communication during patient education? A. Using technical jargon to show expertise. B. Speaking rapidly to cover more content. C. Adjusting explanations to patient's comprehension level. D. Avoiding patient questions to save time. 16. What is the purpose of regulatory compliance audits in dental assisting programs? A. To penalize instructors for student errors. B. To ensure adherence to educational and clinical standards. C. To promote institutional marketing. D. To limit curriculum flexibility. 17. The feedback sandwich method is effective because it does what? A. Ignores negative comments. B. Begins and ends feedback with positive reinforcement. C. Focuses solely on errors. D. Avoids giving constructive advice. 18. An EFDA instructor developing new materials should prioritize what? A. Peer review approval. B. Alignment with competency-based outcomes. C. Instructor convenience. D. Minimal content repetition. 19. When a learner struggles to integrate feedback, what should the mentor do? A. Provide additional practice opportunities and reinforcement. B. Lower performance expectations. C. Cease evaluation until improvement occurs. D. Ignore the issue to reduce stress. 20. Which approach best supports lifelong learning among EFDAs? A. Attending mandatory continuing education only. B. Engaging in reflective self-assessment and skill updates. C. Relying solely on experience without review. D. Focusing on clinical routines only. 21. What is the primary role of a clinical instructor during evaluation? A. Criticize without offering solutions. B. Observe, measure performance, and guide improvement. C. Allow students to assess each other exclusively. D. Grade without feedback. 22. The term scope of practice for an EFDA refers to what? A. All dental procedures performed by a licensed dentist. B. Tasks legally permitted under state regulations. C. Any activity deemed necessary by the assistant. D. Clinical supervision protocols only. 23. When developing assessment criteria for dental restorations, what must the instructor ensure? A. Subjective interpretation of results. B. Clear, measurable performance standards. C. Limited feedback after grading. D. Focus only on aesthetics. 24. An EFDA program aligned with adult learning principles should emphasize what? A. Practical relevance and self-direction. B. Instructor-led memorization. C. Avoiding critical reflection. D. Standardized pacing for all learners. 25. What should a mentor do when noticing a student's anxiety during clinical tasks? A. Offer reassurance and incremental challenges. B. Increase workload to improve resilience. C. Dismiss the student from the procedure. D. Ignore emotional factors to maintain objectivity. 26. Which federal act primarily governs patient privacy in dental practices? A. HIPAA. B. C. D. 27. Effective communication among dental team members ensures what outcome? A. Compliance with clinical protocols and patient safety. B. Reduced collaboration. C. Increased patient wait times. D. Isolation of responsibilities. 28. Curriculum evaluation is best conducted by doing what? A. Comparing student performance to stated objectives. B. Reviewing only course attendance records. C. Measuring instructor popularity. D. Eliminating student input. 29. Which of the following best exemplifies formative assessment? Midterm exam. B. Continuous feedback during skill development. C. Final board examination. D. End-of-term presentation. 30. In a clinical mentorship setting, what is the mentor's role? A. Encouraging reflective practice and continuous feedback. B. Assigning tasks without guidance. C. Avoiding direct communication. D. Relying solely on evaluation results. 31. Which teaching strategy aligns with Kolb's experiential learning cycle? A. Lecturing without practice. B. Learning through experience, reflection, and experimentation. C. Testing without explanation. D. Reading textbooks exclusively. 32. What is the most effective strategy for maintaining compliance with infection control training? A. Annual retraining and documentation audits. B. Informal verbal reminders. C. Optional review sessions. D. Student self-declaration of compliance. 33. When assessing an EFDA's proficiency in composite placement, how should the instructor evaluate? A. Observe performance and rate based on objective criteria. B. Allow unsupervised self-reporting. C. Use only peer evaluation. D. Evaluate theoretical knowledge only. 34. Which communication barrier most often affects dental team efficiency? A. Active listening. B. Assumptions and unclear instructions. C. Structured documentation. D. Constructive questioning. 35. A learning outcome that states students will be able to place Class II restorations meeting clinical standards is an example of what? A. Measurable and performance-based. B. Vague and unaccessible. C. Irrelevant to clinical goals. D. Theoretical and non-observable. 36. Why must instructors review the Code of Ethics for dental assistants? A. To ensure adherence to professional conduct and patient welfare. B. To limit their teaching flexibility. C. To develop promotional materials. D. To avoid certification exams. 37. The ADA encourages continuing education primarily to achieve what? A. Promote professional growth and competency. B. Increase certification costs. C. Replace practical experience. D. Limit competition among EFDAs.